Is it live? I think we are live. Hi, I'm Stacy Roseman, and I'm here with Doug. How do you say it again, please?
Caporrino.
Caporrino. Is that a name or what? With a gorgeous man. Doug is a functional medicine nutritionist, and he had a heart attack a couple years ago. All the way around in fitness and in health and wellness, Doug is an expert. He is a real superhero healer, and we're really grateful to have him here. So I'm going to let him just start and talk about his story and how he can recommend and help you out. Okay, thank you. Welcome, Doug.
Hey, Stace, how are you? Thanks for having me on.
Thank you for coming.
One of the things I always recommend to any of my clients / patients when they hit a certain age is to get something called a cardiac calcium score done. It's the most definitive test that you can get to determine whether or not you are at risk for heart disease or have heart disease. So I was at that age, so to speak, where I said, you know what, let me get it done myself. And I did, and my numbers were a little elevated. So I went to my cardiologist and I said, look, put me into the cath lab. Let's see what really is going on there. And he said, look, no need. Let's do a nuclear stress test. And I said, I really don't want to do a nuclear stress test. It doesn't tell you anything. He said, please, let's just do this. Let's go through the formalities. Sure enough, nuclear stress test, passed it with flying colors. Echocardiogram, passed it with flying colors. Several other tests, passed them all with flying colors. I said, please, just put me into the cath lab so I could see what's going on. And he said, no need to, just come back and see me in a year. Well, needless to say, about 2 months later, I ended up coming down with COVID and unfortunately wound up in the emergency room. And the doctors recommended to intubate me because my heart was working overtime. And just as they were getting ready to intubate me, sure enough, I had a heart attack. And so they stabilized me before they can actually get me to the heart hospital. And once in the cath lab, I had 100% blockage in my circumflex artery. Now, my heart was in such great condition, being a triathlete, that it actually created its own bypass. So that's why it didn't show on any of the other tests, the nuclear stress test, echocardiogram, none of them.
You are a superhero.
So again, you know, they stented me, and obviously I was in a coma for about 7 to 9 days. And I speak like this now because they had to re-intubate me 24 hours after the first one because the tubes developed a leak and I got a subcutaneous emphysema across my chest. And on the second time that they intubated me, they actually destroyed my right vocal cord. So I've had 2 surgeries already on my right vocal cord, but you know what? It is what it is, and I go with it. I just thank God that I'm here and I'm able to do what I do.
Yeah. Wow. What an amazing story, Doug.
Yeah.
He's an Ironman. I mean, he's been in fitness and health and wellness. I met Doug about 9 years ago, maybe something like that.
Probably a little bit longer than that, I think. Probably
a little bit. I haven't been down here much longer. So yeah, I mean, you were big in this back then, and you already had a huge name for yourself.
Yes.
So what exactly do you do? What exactly is functional medicine?
Yeah, so I do very specific blood work that most doctors don't do. When you go to a doctor and get blood work done, you usually give your blood and you get the results back in about 2 to 3 days. That's called blood serum. That's only indicative of actually what's in your bloodstream. What I'm looking for is actually what's in your cells. So what I do is called intracellular work. We extrapolate the cells, we grow them in petri dishes over 2 to 3 weeks so that we can actually see what the cell membrane is absorbing or not. So the old adage that you are what you eat isn't necessarily true. You are what you absorb. And there's an area in the gut called the microbiome, which has really been the area of my expertise for the past 12 to 14 years. And that's an area of the gut where everything either gets absorbed or doesn't get absorbed. So I'll give you, for instance, I just had an ER doctor come to me about 4 months ago, and he's been a vegetarian for 10 years, taking a ton of supplements, leading a very healthy lifestyle. Mm-hmm. And his test came back as one of the worst tests I've ever done. And he said, how could that be? Look at how I live. Look at my lifestyle. I said, because at some point you took an anti-inflammatory, you took a Tylenol, an Advil, or you took some kind of an antibiotic, and it destroyed that area of your gut where everything gets absorbed or doesn't. So until I repair your gut, anything that you're doing, your body is not going to assimilate. So that's really what I do. I come at things from a very different area than doctors do. I don't look at symptoms. I look for the cause. And I keep
Okay.
going back at the layers of the onion until I find out what that cause is.
So, for example, I don't know, like 8 years ago, I went, I think, to a functional medicine doctor. I think she was to check like my mercury leather levels and metals in my body and stuff. I did have mercury poisoning. I did get rid of it. And most of people, you would know better, but do most people, do you think, have mercury poisoning and just don't know about it?
Well, that's a great question. And let me back that up a little bit. So when you say you had mercury poisoning, did you do blood work or a urine analysis?
No, I did blood work.
Okay.
I did do both. Yeah, I
And
did
it was
extensive.
So here's what I do where most people make the mistake is that heavy metals lodge themselves into the cell membrane. And in order to get an accurate test, you need to leach those heavy metals out into the bloodstream so that this way you get an accurate test when you do the urine analysis or the blood work. And the only way that you can do that is by using what's called a provoking agent. So I do something 24 hours before the test is done to leach those heavy metals, if there are any, into the bloodstream so that we get an accurate test. More often than not, sometimes those tests are inaccurate. So I like to be, again, as specific as possible. I like to quantify and qualify everything that I'm doing.
Do you feel like most of the times, Doug, that it is the microbiome? You feel like that's usually the case, or you find all different kinds of reasons behind heart disease?
That's a great question. So most of the time, look, it is 75 to 80%. When people, think that their genes are responsible for heart disease or their health, they couldn't be more wrong. When you take a look back at something called the Human Genome Project, which was the largest project where they followed over 40,000 people for 20 years, they actually determined that your genes are responsible for less than 10% of your health. So you
Wow.
have the ability to change the way your genes express themselves.
So, do you believe that we can, working at the cellular level, change our DNA?
Well, you can change the way the DNA expresses itself, not so much change your DNA, but you
Okay.
have the ability to change whether or not it's bad DNA and whether or not that DNA expresses itself or not.
I
Interesting.
really have to come to you.
Yeah.
No, I'm serious. I do. Because that was about 10 years ago. I need to have it done now. I've had, with all the titanium in my body, I mean, I'm not having residual effects from it that I'm aware of. And my pain level, once in a while, I take a Tylenol
Okay.
for pain. That's it. I don't take anti-inflammatories. I have meloxicam and Celebrex, but I don't take them. I'd rather try to do it through a plant-based diet and meditation and mindfulness.
Okay. So once again, all good things to do, but how do you know what you're doing is actually right for you? And that's why I do the kind of testing that I do. I do micronutrient testing. So it actually measures every single nutrient in the body, which is actually then a blueprint for you to follow. Most people take supplements randomly, not knowing whether or not they even need them or whether or not they're even absorbing them.
Right.
So I like to, again, know quantitatively that what you're doing is actually working and that your body
So
needs.
you could be on a plant-based diet and not be absorbing any of the nutrients, is what you're saying.
That's one possibility. And the other possibility is, guess what? A plant-based diet may not be right for you. I'm one of those people. I tried being on a plant-based diet for over a year and a half, and it didn't work for me. My blood levels went in the tank. I tried being a raw foodist for a year. My blood levels went in the tank. I'm meant to be a mixed carnivore. And people fall into one of those three categories. They either meant to be a vegetarian, a raw foodist, or a mixed carnivore. And you're not going to know, again, until we do the proper testing as to what that really looks like for you.
So
why
different
would you?
bloods. I'm sorry, go ahead.
Why do you think that the medical system is so adrift on different testing? Because I had that happen when I had my stroke. They did not test me for the things. The testing was all over the boards, and they didn't really test me to figure out. I still don't know why I had a stroke. They tested me all different types of things, but it's more like vitamin levels. It wasn't really anything worth testing. Like they did genetic testing a year later, but that was really the only two testings they did.
Yeah, so the unfortunate thing is in the medical society, they have to follow what's called the standard of care. And the standard of care is actually written by the insurance companies. And doctors follow that so that they can't be sued and they can't be held liable. So wrong, right, or indifferent, even if it doesn't find what the cause was, they can say, we did everything that we needed to do. So that's why they don't take it to another level. My testing, believe it or not, most doctors won't even look at it or put their name on it because they go, well, if I don't know how to read it, or if I don't know how to take it to the next level, then I'm responsible and I'm liable. So they won't even go near it. That's why they follow the most testing that's antiquated these days.
Because they
So
don't
what
want to
kind
be
of school-
liable.
Correct.
What kind of schooling did you have to go through for all this?
Uh, so many years, many certifications, many traveling all over the world. I did a lot of studying in Europe, and my studying never stops, by the way. I'll continue to learn until they throw dirt on me.
So I have a friend that just contacted me. He's in the hospital. All of a sudden he started seeing double vision and he's got white in his brain and he was getting dizzy. But yeah, yeah, I don't know. He's in the hospital now. I told him to please watch this because he said it could be, they don't know, it's MS signs or heart attack signs and stuff. So he's got to get, obviously more work done. Anything you recommend for him to do? Like, could you help him out in any way?
Well, funny you mentioned MS. MS, lupus, and Alzheimer's are the most three misdiagnosed diseases in the United States. I'll give you, for instance, I had a dear friend who was diagnosed with MS years ago, and she went to three of the top doctors in New York City. All of them said and confirmed, you have MS. Started her on this whole course of corticosteroids over a couple of years. The side effects were tremendous. I begged and pleaded with her for years to please do a heavy metal toxicity test. Finally, she did, and she was rampant in several heavy metals. We chelated those out of her system. She never had MS. So again, for
Wow.
somebody like him, I would encourage him, not knowing anything about his history or his past,
Yeah.
to probably, again, look into getting a heavy metal test done.
Okay. So for how about with anxiety and depression and, with COVID and everything? So, the after effects of all this and your way of living and your healthy lifestyle, are there ways to help lift these areas? I mean, thank you also for sharing your kind words and motivation and gratitude and all that every day. It really makes a difference. It makes a difference to me, and I'm sure it makes a difference to a lot of people.
Well, thank you. Yes, to answer your question, look, my first book, which was a bestseller, Tell Me, Teach Me, Heal Me, How to Get Healthy Before You Die Trying, was so popular that I ended up coming out with a second book, which should be launched within the next 3 to 4 weeks. And that is How to Survive and Thrive Long COVID. There are so many different things that people are going through post-COVID, post-vaccine, by the way. On a weekly basis, I get probably 20 or 30 people that are contacting me post-vaccine injury, post-COVID injury. So there are a lot of different things that you can do. Again, it's peeling back the layers of the onion and understanding really what their symptoms are and what the cause of those symptoms are, and then addressing those at a cellular level.
I'd much rather go to you than a regular doctor any day.
Well, look,
No, I'm serious.
The good news is I have a wealth of resources. When people sign on with me, they just don't get me. They get all of the different doctors and NDs and DOs that I work with all over the country. So if something is out of my wheelhouse, look, I don't have an ego. I'm just concerned in getting the person healthy. So
You
I'll
are
reach
very
out.
humble.
So I'll reach out to one of the MDs or DOs or somebody that I work with or closely with and say, hey, look, really, try to talk to them or get into a conference with them and figure out exactly what's going on with the person. And if I have to refer them out, I refer them out. Like I said, my biggest concern is just getting the person well.
So with PTSD and anxiety and depression, though, like all these, they do have long-term effects on this. So do you think like the COVID and the shots or it's like all of that? And
Yes, a lot of it is responsible for it. So when you take a look at PTSD, there's a tremendous amount of side effects that come from both of those situations. And there's a lot of things that you can do for it over a short period of time. One of the biggest things, my claim to fame, is hyperbaric chamber therapy. I got out of the hospital and I was literally in a hyperbaric chamber immediately. And I've used it in the past also for post-surgical practices as well. It's one of the biggest healing mechanisms out there in the market, and most people just don't know about it or take
Right.
advantage of it.
So where would you go, or where would you recommend me to go? Or, I mean, would I need a referral from you? I know you have to pay cash for that, right?
Yeah, most of it, well, again, it depends on where you go. Some of it can be covered by insurance, but
Okay.
we're lucky where we live here in Florida because there's virtually a hyperbaric chamber, in every square mile. So there are
Really?
there's plenty of places down here to go. And like I said, it really works wonders on the body.
Yeah, I mean, I've known about that for years. I haven't had the opportunity, but I would like that opportunity. So I'll reach out to you later on. Maybe you can tell me somewhere around here, and I want to set something up with you. I want to get my blood work done again.
Sure.
Okay. And then you need to come back on here and promote your other book. I did promote your book.
Great. Thank you. Yeah,
What
the
else
book
do you
is a
want to?
wealth of information. People call it their encyclopedia of health. There's literally over 400 pages of every single subject you
Wow.
can think of, everything from personal care products to you name it, everything that you should be doing on a daily basis to stay healthy, the different types of blood work that you should be getting to be able to tell ahead of time whether or not something is coming down the pike. So again, we have to be proactive about our health.
Yes.
It's not about being reactive and not about just, again, settling for the diagnosis that you get the first time. What I always say to any of my clients is don't become your diagnosis. You need to become your own advocate
Right.
and
I'm getting the
literally,
chills.
exactly, and literally take it to several different other doctors until you get the answer or until you get, the questions that you want answered.
Right. And I mean, look, you and I know how long that can take. I mean, it could be a really long process and then getting like misdiagnosed or something. So I think the doctors like you, I don't know if you put yourself under a doctor, whatever, functional medicine, but what do you come under?
Yeah, again, functional medicine nutritionist. And
Okay,
look,
nutritionist.
thanks. No fault of most of the doctors today. They've just not been taught it in medical school. Most
No.
doctors, if they're lucky, get one semester of nutrition. So most of them, again, are being taught how to address symptoms. And then all of their postgraduate studies and education, the majority of it comes from the pharmaceutical system. Being educated by pharmaceutical reps that are walking in their offices, it's literally, a pill for every ill. I just had a client come to me on 11 different medications. I mean, that's criminal in my eyes. And the majority of her symptoms were being caused by the medications. I'm happy to say she's down to 2 medications right now at
Yay.
6 months. And not to say she's going to be off of everything in another few months. But look, it's not, drugs work at the proper timing when we do need them. But for the most part, drugs aren't the answer. It's literally just putting a Band-Aid on what the symptom is. You got to find out what the cause is. And you just got to keep digging and digging and digging until we find out what that is.
So I had plant-based shots in my knees the other day. Plant-based Tramil or something. Do you know what it is?
Traumamil. Yeah,
Tramamil?
Traumamil. Yep.
Is that also a cream?
Traumamil does come in a cream as well. They have a
Oh my
cream and
God.
an injectable as well. I do a lot of work with peptides. Peptides, I believe, are the wave of the future when it comes to health,
Stem
anti-aging,
cells?
and longevity. Peptides you can take either orally or injectably, and there's literally peptides for everything. You have a problem sleeping, there's a peptide. You have a problem with pain, there's a peptide. You have a tear in a meniscus, tendon, or ligament, there's a peptide. So there's a lot of different things that you could do with peptides
What
to
can it do
literally
for?
reverse the clock.
All right, so I had a torn medial and lateral. I mean, no big deal. I walked out of the surgical center when I had it done. The doctor's like, you can walk out. I mean, I've had enough surgeries. It's like going to the dentist for me. So I walked out of the center. There was a tear in the medial and lateral meniscus. How could I have prevented that and taken a peptide to heal that?
Yeah, so there's 2 peptides in particular, one called BPC 157 and another one called TB 500. Both of those actually go in and actually help heal the tendons and the ligaments. And if that doesn't work, there's something else that I recommend, something called prolozone therapy. Prolozone therapy is where they go in through guided imagery and with a needle inject medical grade oxygen into the area of the injury. Works great for people with herniated discs that are bone on knee, and it expands the area and allows growth factors to actually come in and heal the area. It actually works better than stem cell and PRP.
I was going to ask you because the doctor did mention about getting some PRP, but I didn't feel like I needed any after I had that procedure done.
Yeah,
But I just,
PRP, a lot of it is overrated and overstated. I took courses for over a year on PRP and stem cell, and the success rate is a lot less than what they lead you to believe. So I would use it as a last resort and try these other natural things first before heading down that path.
how about breaking up like scar tissue, where like surgical procedures have been done and the fascia when it heals it with the scar tissue? And yes, do you know any way to dissolve that?
Yeah, that's a great question. So when scar tissue starts to form, it's actually called fibrin. And when that fibrin is forming, you have an excellent opportunity to dissolve that. Proteolytic and pancreatic enzymes. In fact, I just released a product called Skinnyzymes, and I was working on it for over a year. I call it Skinnyzymes because as a side effect, people who are actually heavy did actually lose weight on it. But the main purpose behind it was to bring down inflammation, break up and literally dissolve scar tissue, increase digestion, and help with hormones as well. So yeah, enzymes actually work wonders at breaking up and preventing scar tissue.
Okay, so this is the product that is on your Facebook page?
Correct. It's called Skinnyzymes.
Okay. Okay. So if I'm not going to necessarily lose weight though. I don't really want to lose weight. I would be happy building some more muscle. But yeah. But so could I not lose weight on it though too?
Absolutely. So again, the
Okay.
people that we used in our trial, the ones that were real heavy as a side effect, ended up losing some weight from it. But for the majority of the people, it brought down their inflammation, it increased their digestion. They just felt better overall, especially in areas where they had had previous surgeries.
Right. And bringing down inflammation is extremely important. I mean, we get in our brain, we get the inflammation in our brain, we get it everywhere in our body. And
Correct.
it can be really detrimental for a lot of different things and causing a lot of problems in the future.
Well, inflammation is the root of all disease, believe it or not. We've been led down a path thinking that high cholesterol is a reason for heart disease, and that's simply not true. It's actually inflammation that creates the heart disease. Most doctors today, staying on that course, will do a standard lipid panel. It'll come back with what your HDLs are, LDLs, what the ratio is, and what your triglycerides are. That's an antiquated test. You should be getting something called a fractionated lipid panel. That actually takes a look at the bad cholesterol, the LDL, because that comes in 4 different sizes: small, medium, large, and large. Why is that important? Because you can have a high number of cholesterol, meaning 300, and those bad cholesterol numbers, the LDLs, if the small particle sizes, which are the real bad ones, those are the ones that create plaque. If they're in the basement, guess what? You're not at risk for heart disease. And vice versa. I've had people come to me where their cholesterol number is 150 or 140, but that small particle size of the LDL is through the roof. That person's a heart attack waiting to happen. So again, it's understanding what inflammation does and the part it plays in overall disease.
All right, I have another question for you. So when I found I had mercury poisoning, I took merc out. I changed my diet. I stopped eating fish for like a year. I only ate non-GMO chicken and the organic vegetables. And I had to test it. It did go away. Probably have it again, but time to do that again. Okay, so I got the metals taken out of my mouth too. I was told to get the metals taken out of my mouth and then go over to the woman that I was going to at the time who does like what you do. And I got intravenous. What did I get?
Probably glutathione.
Whatever it was for the mercury particles, from taking that out and putting white fillings in.
Okay. So look, here's the thing, when it comes to inflammation, again, and talking about getting heavy metals out of the system, number one, you just mentioned chicken a moment ago. Chicken is one of the worst things women could eat, by the way. Anytime I get a woman eating less or no chicken, they will immediately drop 3 to 5 pounds.
Why?
Because chicken is very inflammatory to a woman's body.
Oh.
Even if you're eating organic chicken, there's a certain amount of antibiotics that is in it. Also, before any kind of chicken is sold, they actually dip it in bleach. So even if you're eating organic chicken, that's also being, again, prepared that way. Number 2, heavy metals. Again, it depends on what the person is doing to leach them out of your system. There's many different protocols that I use for many of my clients, depending on the degree of toxicity in their system. I will develop personalized protocols that they do once a month. Sometimes I'll do something on a weekly basis. Everything changes and is personalized based on the individual.
Okay, so anybody can come to you, and if it's you do a whole realm of tests and things, but what you would send them out to somebody for something very specific if they needed that?
No, what I do is everything I do is telemedicine, by the way.
Okay.
I literally have clients all over the world, Australia, London, you name it. I have clients. And this is what I do. I speak to them on a weekly basis. If it's somebody here in the United States, I'll write the script. I'll send the script to them, send it to a local lab. They get a kit in the mail. They'll get the blood drawn. That gets FedEx back to the lab that we use. And then I get the results back in about 2 to 3 weeks. And then we go over a report of findings and we develop a plan for that person. If we need to, again, take it a step further and do further testing, I do. I tend to be very frugal with my clients. I get people that come to me that have had thousands of dollars of blood work done needlessly. And I'm saying, there was no need for you to get all this blood work done. I do one step at a time to see what it shows. And if we need to go a step further, we take it a step further.
I am so grateful for you being on here today. Your book's coming out in a couple weeks.
It should be out in about a month and a half, the new book. The older book you can get on my website, Barnes & Noble, or Amazon.
And it's called?
Tell Me, Teach Me, Heal Me.
That was the other book.
Yes, How to Get Healthy Before You Die Trying.
Yes, I promoted that all over the place.
Thank you.
Love the name of it. I do. I love the name. But the next one coming out, you said in a couple weeks.
Yes,
Same
it's
thing?
going to be How to Survive and Thrive Long COVID.
Okay, that sounds great. I'm really excited. And yes, I've had a couple friends that I've spoken to that are having long-term COVID, brain fog and problems. So send them to you?
Yes, absolutely. Again, I'm dealing with them on a weekly basis right now. And the amount of cases that are out there today, the amount of cases that are going unreported is unbelievable. So it's a very bad thing. And it's something that we're going to be with for a very long time.
I just read something. It was on the news about it's another virus. What is it? I read it this morning.
Well, there's a few that are coming out. I mean,
mosquitoes?
COVID could be. They're thinking about again. The West Nile is actually coming out again. The H1N1 is making a resurgence right now. There is another form of COVID that's going around right now. Look, COVID is here to stay forever. There's too much money in it and too much money to be made that it's never going to go away. So unfortunately, that's the world that we live in right now. I just recently got the minutes to the last Pfizer stockholders meeting. And again, if you read them as I did, you would fall off your chair. They were telling their stockholders that they were doing everything in their power to lobby Congress to make sure that these boosters stay in the system every year because it represents billions of dollars to our bottom line. So look, again, this is all about money and greed, unfortunately.
Can I ask you if you got
I did not.
shot? You did not.
I did not.
You're against them.
Every single ICU nurse and ICU doctor came up to me and said, it's a good thing you didn't, because anybody that did would have left here in a body bag. So they said it was only because you were in the kind of shape that you were in and because you didn't get the vaccine that you walked out of here.
Thank God.
Yeah.
We need you here. You can't go anywhere. So can I ask you, when was your first superheroes healing that you realized that you had gone through something and you really have something special you need to teach the world? What was that first moment?
Well, I always believed that I was here for a purpose, even before this. And for many of you that have read my book, you know my story. And for those of you that haven't, I encourage you to get the book and read my story in the beginning of it. After going through my last ordeal, which was 1 year, 8 months ago, I got out of the hospital and literally looked at myself and I looked like I got out of a concentration camp. I lost that much weight in the 2 weeks that I was in. I couldn't walk 10 feet without a walker or without being on oxygen. I was just literally, I had hit rock bottom. And I just looked up and said, the good Lord kept me here for a reason and for a purpose. So I didn't let it get me down. If I had a dime for every time somebody asked me if I was depressed or angry, I could have retired. And I just said, look, what do I have to be, down or angry about? I'm here. I came
Right.
through something that most people would not have been able to. So at that point, I just said, look, I'm here to help as many people as I can, and I will continue to do so until, the big guy upstairs takes me.
So do you think that because of all your knowledge that helped to save your life too? Or do you
Uh,
think it's just because you were in the right place at the right time?
Yes, yes, and yes. I think right place at the right time. Certainly the kind of shape that I was in before going in, and certainly again, by the grace of God, that I'm still here. I've had many near-death experiences, so this was probably the greatest one that I have gone through. And again, I am here for a greater purpose, and I'll continue to share that and my knowledge for as long as I can.
Thank you. I'm so grateful for you, for everything about you and everything that you are. Will you come back when your book's out?
I sure
This
will.
other book.
Absolutely.
Do you want to say the names of them again one more time?
Sure. So the first book is Tell Me, Teach Me, Heal Me, How to Get Healthy Before You Die Trying. Second book, How to Survive and Thrive Long COVID.
Okay, I'm going to promote them. I'm going to pin this to the top of my page so people can watch it like for the next week. It's going to be everywhere anyway, but I'm going to pin it so they can watch it for the next week. I'm sorry about what happened with your throat.
It's okay. It's all right.
If that's the worst of it.
I agree.
How long did it take you to come back from the heart attack?
So literally, I was back in the gym after about 2.5 months. And I literally, when the PT first said, let's establish, some goals here. And I said, well, I'd like to do another triathlon in 7 months. He tapped me on the shoulder and said, why don't we think of more realistic goal? So once they told me that, I'm the kind of person, tell me I can't and I will.
Give
7
me a
months,
challenge. I'll take it.
7 months later, I did my first triathlon again in Jupiter, Florida. So again, I made a full recovery.
Absolutely amazing. Thank you so much for sharing everything and coming on today. And we'll see you in a couple weeks, I hope.
Sounds great, Stace.
Okay, have a great day.
Okay, you too.
Bye-bye.
Bye-bye.
Call you in a couple minutes. Okay, thank you. It didn't work. It didn't work. You know what? I got a problem. Doug, that was the best podcast ever, period. And I'm looking